Hey guys, it's Rodney. Retention of mental health nurses in rural areas. Began with the premise that mental health nursing would be deficient in rural areas, being that they have fewer people, less medical centers, less clinics. That that would be the case. Found that this is true. There is a need for mental health nurses in rural areas. Urban areas need them as well. The deficit is just greater in rural areas. 2001, North Carolina restructured, went from state-supported hospitals and treatment to community-based, and left a lot of holes and a lot of places for people to get lost. Ben David in the newspaper this morning, the Star News, February 9th, is quoted as saying he's seen the collapse of mental health system because it's showing up in the jails, that they take up more time, they cost more, and they're difficult to prosecute, and they're not getting the treatment that they need. According to the Mental Health Associate report to the Texas Conference of Urban Counties, it costs 3 times as much to jail an inmate who has mental illness as it does to an inmate who doesn't. They also said that ER is overused by people with mental health because they don't have that safety net. That's what we see at our hospital anecdotally. Hear stories from the nurses how people just come and sit and wait trying to find a bed to get treatment. People who have the same goal, I guess, as I do, would be like people like the Health Resources and Services Administration and their Office of Rural Health, the National Rural Health Association, the World Health Organization, who says that mental health is an integral part of a healthy person. Healthy People 2020 topics and objectives under mental health and mental disorders. Their goal is to improve mental health through ensuring access to appropriate quality mental health services, which having more nurses in rural areas to take care of mental health patients would accomplish this goal. Not having that social safety net there for people with mental illness does wind up costing us all money, and it's something we really need to look at resolving. As far as how do I feel about writing the sections in this way, I sort of believe that writing the sections this way has helped me to focus in more on each section, take it section by section, week by week, instead of someone saying, okay, write this and you've got a week to do it. It gives you more time to get down and focus on it, especially when time's limited, like it is when you're taking a class online. You've got a job, you've got family, you've got responsibilities. It sort of gives you a timeline already to get stuff done, so I think it helps me to focus. As social media has helped. Some of the things I'm following on Twitter have given me information for this report. Facebook, I've been able to connect with some other nurses that I'm friends with in different areas and get their input, get advice as to where to look for some information. So I think it's an area that can aid you a lot when we're doing research and digging, trying to get to more information for our projects. Thanks a lot. I hope everyone has a great one and good luck with the rest of the semester.